already hear from from the TikTok live. People were asking me about the complications of anesthesia, and that's a great question that a lot of patients don't think to ask because they're really anxious before surgery. I totally get it, right? Because you're gonna have, these tense medications. They're gonna maybe make you unconscious. You're gonna have a breathing tube, and it's hard to even know what to ask. It's the most common thing that patients tell me. They're like, "Hey, doctor, I don't know what to ask." So what are the things that you should know about your body? Because when you're under anesthesia and you get the breathing tube in place, like, you can't ask any more questions, right? And the more preparation you have before you fall asleep, the better prepared you can be to help minimize some of those complications. That's right. So there's four things that happen to your body under anesthesia that a lot of patients kind of wish they knew. And hey, Heidi, hey, good to see people trickling in. I love it. Hello. We're talking about four things that happen to your body that you probably never knew about when you're unconscious under anesthesia. And a lot of them, if you can prepare for, you can actually help minimize the side effects. So, what's the first one? The first one that everyone's always concerned about is that, hey, when we give you general anesthesia like propofol, it actually turns off the parts of your brain that are responsible for your breathing. You have many reflexes in your body that will cause you to breathe harder when your blood oxygen level goes down. But anesthesia turns off those reflexes. It turns off a lot of reflexes. Otherwise, we couldn't do surgery on you, right? Because you would slap us or move around because of the pain of the surgical incision. So we need to blunt your reflexes. But you can't only blunt some reflexes, you end up blunting a lot of them, including the ones for your breathing. So the first thing is that you're not really breathing very well when you're under anesthesia, which is why we have to support your breathing with things like breathing tubes. But they have side effects, right? So what are some of the things that you can do to naturally reduce the side effects? Well, the biggest one is going to be sore throat. Did you know that chewing gum before your surgery can actually help minimize the sore throat from breathing tubes? And chewing gum does not increase the risk of aspirating things or vomiting and aspirating, which is a big concern under anesthesia. So always talk to your anesthesiologist and your doctor about chewing gum. So if they're okay with it, you can help minimize the risk of sore throat. In terms of sleep apnea, patients with sleep apnea may have a harder time. You may have a harder time, Heidi, thank you for that comment there, I appreciate it. We may have a harder time placing the breathing tubes in patients with sleep apnea. So using your CPAP before your surgery is one of the most important things to help minimize the risk of airway complications as well. All right, so that was the first one. Let's take a quick break and look at our comments. And just as a reminder, I did publish a video earlier today on anxiety and anesthesia. Anxiety is one of the, I should say, treating anxiety is one of the best kept secrets in medicine, ways that you can naturally get control your health. Then check out that video because nowhere else is it more apparent what happens to your body, what anxiety does to your body than when you're in the operating room. So let me catch up with these comments here. Pika Kirby, good to see you. Nick A. Is Halcyon safe for conscious sedation? I've never used Halcyon. I can't comment. JP, good to see you. Quitting vaping. Well, Ronan Hokinson, quitting vaping, that's a different one. If you're going to have anesthesia just to quit vaping, there are certain things like ketamine-assisted psychotherapy that might be able to help with that. You don't need to come into an operating room for that. It's a very good question we should talk about offline at a later point in time. ACDF surgery, Lindsay LaCroix is having ACDF surgery. I'm wishing you the best of luck, Lindsay. Hope everyone here sends you some positive vibes. We wish the best for you. I have sleep apnea. I need to bring my CPAP. That's right. Snapper girl. Wish you the best of luck for that surgery as well. And do bring your CPAP. It's important. Okay. Triazolam, Brandon. I've never used triazolam either. I use things like midazolam, oh, you can't see that, can you? Diazepam, midazolam, and a couple other agents, a couple other benzodiazepines. Lorazepam sometimes as well, but usually in anesthesia we use IV midazolam. Okay, guys, so we were talking about four things that happen to your body when you're asleep under anesthesia that you probably don't know about because, well, you're asleep. So one of them was the breathing tube. But here's a question for you all. What else gets turned off? What other reflexes get blunted in your body from anesthesia? I'll give you a shout out if you tell me which one it is, and as a hint, it's the reason behind using this medication frequently. Can you guys see this? Why do we use this medication in the operating room? And just as a reminder, if you guys are learning something and appreciate me coming on at the end of a long day in the operating room, do please hit that like button and share with others, and subscribe if you haven't already, because your support helps me do this more often. Can you guys see this? I don't think it really... Oh, there we go. Here we go. What medication is this? Why do we use it? You guys can see that now, huh? Hey, thank you, Sneha. What other reflex gets blunted with this medication? Yes, anesthesia, Vanessa. So anesthesia turns off your body's reflexes. We talked about how it turns off your breathing reflexes, so that's why you don't breathe well. It also turns off... Oh. Also turns off... Well, hey, James, thank you for that tip. I really appreciate that. Also turns off your heart reflexes. Your blood pressure can tank under anesthesia. And it's because there's various reflexes that tell your heart, between your heart and brain, how hard to pump, how fast to pump. Your heart rate, your systemic vascular resistance, all these things change under anesthesia because the reflexes behind them get blunted by medications like the IV one here, propofol, or from the anesthesia gases that are going into you through the breathing tube, okay? So that's why the second part is that we're completely supporting your heart and your blood vessels, your blood pressure. Did you know that? In the medical coma that you're in, I'm going to move the camera here for just a second so you can appreciate. I'm in an operating room here, guys. This is an empty operating room, right? Hopefully you'll never have to be in an operating room. But if you do, by knowing what happens to your body, you can prepare, because your heart rate changing, your blood pressure changing can be dangerous under anesthesia. But the more physical conditioning you have before surgery, the less of these medications we need to give you, and the less... Let's get it in focus there. This is ephedrine. By the way, this comes from a plant. Do you guys know ephedrine comes from a plant? Pretty cool, huh? Comes from a natural source. But the point is that there are many ways that you can naturally condition your heart and lungs to tolerate anesthesia more safely. So in terms of natural ways of preventing complications, minimizing risks of heart attack and stroke, especially for major surgeries, think open heart surgery or lung surgery, etc., the more conditioned you are before, the less of these medications you'll need, because your heart and lungs will be more prepared to tolerate the stress of anesthesia and surgery. All right, so that was number 2. Let's see, what other comments do we have to catch up on? Neurotransmitter. Colleen, good to see that went well for you. Nick A, how much harder is it to juggle anesthetics with idiopathic hypersomnia? Nick A, I've never had a patient with idiopathic hypersomnia. I've had patients with many other sleep disorders, and we titrate our anesthetics to effect using the monitors like the one behind me. I didn't connect myself to it today in the interest of time here, but we do need to use all of the available tools in our physical exam to determine how much more anesthesia you need. I don't give more anesthesia just because someone has red hair or just because they haven't necessarily a medical condition like Ehlers-Danlos. I give my medications based on totality, the holistic view of that patient when they're under anesthesia. Good question. How does marijuana impact anesthesia? Brittany, great question. I have a video on it. I have another video I got to do soon. Actually, check out the video I posted this morning. I had a patient who had serious asthma reactions. They told me afterwards how much marijuana they smoke. They weren't quite upfront with me before. Did you catch that? So they weren't quite upfront with me. They were smoking a joint in the parking lot, it sounded like. So, big impacts when you're under anesthesia, because anything you smoke affects your lungs, right? No joke, it does. Check out that video. I talk more about it, because I still have 2 other things I was going to talk about here. I was talking about the 4 things that happen to your body when you're under anesthesia. Smoking any drugs smoking anything like meth, cocaine, heroin, whatever. You don't smoke heroin, but smoking any of those things impacts how your brain interacts with anesthesia, impacts how your heart reacts to anesthesia, and then using these high potency medications to keep your heart healthy. It interacts with it impacts how your body interacts with things like breathing tubes going in the back of your mouth or in your trachea. So lots of interactions, which is why you should be upfront with your anesthesiologist before surgery. I had a patient last week, had the whole room set up, Everything was ready for surgery. We went to sleep, and their blood pressure tanked. I could not keep it up no matter how much of this medication I gave. I went through the whole I went through the whole gamut here for medications. I couldn't raise their blood pressure. I had to wake them up. We had to cancel the case. Turns out they had used meth. Right? So very, very potent interactions. This is all in the video that I published earlier today, so check that out. But let's get back to the main topic. I was saying, what are the 4 things that happen to your body when you're unconscious anesthesia? The first one was your breathing. The second one was that your heart control goes totally out of whack. It's why I always keep this syringe in my pocket. Maybe you've noticed here. It's called phenylephrine. Always keep this syringe with me. It's always in my pocket. You've probably seen it. I put a pink label on top so I can quickly identify it. It's life-saving when the heart's reflexes are out of whack. The third one is what happens to your eyes under anesthesia. And then the fourth one is going to be your emotions. So if you want to hear about that, stick around till the end. Okay. Can Lexapro affect anesthesia? Alex, it can. It's actually not too much. Not too much, though. Marisol Guzman, good to see you on here. Does propofol help you decrease nausea? Yes, propofol can reduce nausea, Sneha. Thank you for mentioning that. It's why I actually use a lot of propofol. It's better for the environment, and it's typically better for patients. And hey, Heidi, thank you for mentioning that. For those of you guys who want to get more info, check out the Discord there where I post all the... we have ongoing discussions about cool things about your body that you probably never knew. And I also post when I go live, so you guys can keep up with that. Can Klonopin affect anesthesia? Ronan, yes, it can. All right, Brittany was talking about eyes under anesthesia. Yeah, so you can't blink under anesthesia, and you don't produce tears under anesthesia, both of which predispose you to getting corneal abrasions, and they can be nasty after surgery, which is why I always tape. That's why I have a bunch of tape in the operating room. Where is the tape here? We have lots of different types of tape in the operating room to tape your eyes shut to prevent them from drying out and getting corneal abrasions or infections. So if you have contacts, remove them ahead of time. You don't want us to have to take them out and throw them away if they're expensive. So do yourself a favor. That's how you can help prevent. Corneal abrasions. Just get rid of your contacts before you come in. Wear glasses. Good. Anticholinergic effects, Marisol. Ask me more about that. And the last thing was emotions and delirium and kicking and screaming under anesthesia. What is... Actually, I see someone here. Who was that? Let me give you a little shout out. Snap Girl. You're an eye scratcher after anesthesia. Yes, scratching eyes can also cause corneal abrasion. So it also goes hand in hand with the last thing about what happens to your body when you're under anesthesia. Well, you can be delirious and you can hurt yourself or hurt others around you. You can, elbow people, slap people, scratch your own eyes, give yourself corneal abrasions. The list goes on. But the point is that the better prepared you are with your mindset, probably the lower chance of delirium after. Now, it's not a guarantee because many things can cause you to wake up delirious. Waking up with more pain, waking up anxious, waking up with low oxygen levels, with high carbon dioxide levels, etc. But I'll say in my experience, the more relaxed patients are falling asleep, typically wake up more relaxed as well. It's pretty incredible what's processing in your brain before you fall asleep. It's why, as you guys know, I do very careful clinical hypnosis in those precious moments before the mask goes on and before patients fall asleep, to take advantage of that brief moment to help optimize their mindset so that they hopefully wake up without as much kicking, screaming, crying, yelling, etc. Yes, there's disinhibition, probably at the level of the thalamus, that leads you to say things you would probably never say and act in ways you would probably never act. Can you get addicted to propofol, Stephen? It is possible. Brittany comes out angry after anesthesia. Yeah, you're absolutely not alone. All right. Guys, I need to get going right now. So I hope everyone learned something. If you did, please hit that subscribe button. Your support helps a lot. Check out the videos that I publish and share them with others if you learned something, and share what you learned with others as well to help empower other people to take more control over their health. You have more power over your health than you've probably ever been told. And that's what I'm hoping you guys all gain. Remember, check out the Discord. Please hit that subscribe button, share with others, hit the like button there. And I look forward to seeing you guys hopefully tomorrow for another live. And I'm working on the next video already. I can't wait to share it with you all. So, till then, you have more power than you've probably ever been told. See you tomorrow. Bye.